The next thing that we need to assess in our residents is pain. Care home residents may have lots of reasons why they might be in pain. For example, many of them will have arthritis or have back problems that have caused them pain over long periods of time. So again, it's trying to look for what is somebody's normal level of pain compared to is there a new pain that needs managing. And obviously anyone who's in pain, we want to try and alleviate it. So making sure that they've had their regular painkillers. And if you feel like the pain is not being managed well, then that's always going to be a reason to get some kind of review, which might be the GP to look at their medications. If a resident's unable to communicate to you in words that they have pain, then we need to try and think about the ways that someone might be expressing they're in pain. This might include somebody becoming more confused or more aggressive, perhaps shouting out. It might be someone becoming withdrawn or even curling up in a ball or pointing to a part of their body that feels uncomfortable for them. Sometimes if somebody's in pain, it might affect their sleeping. They might find it difficult to get to sleep, or perhaps they'll eat less or drink less. So these are all things to have at the back of your mind for anyone who's got difficulty in verbalising. However, for those residents who are able to tell you, there is a pain score that we can use that's really helpful for you to not just assess the pain, but also to know whether the pain is being managed well. So if we look at that now, we can see that this is something you can use with your residents. For those who are only able to look at the faces, you can show them that there is a sad and a smiley face, and perhaps get them to point around the number that they feel their pain is at. For others, they might need you to describe the level of pain for them as being either mild or moderate or severe. This might help you to identify the severity of the pain and therefore how urgently you need to respond to it. And we would always remind you at this point that if the pain is in the chest, particularly on the left side, then this is always a red sign or a red flag, and you would need to possibly call 999 for this. As well as understanding how severe the pain is, you also need to find out where the pain is. Not all chest pain is a heart attack, and not every resident with chest pain needs to go to hospital, but any chest pain requires an urgent assessment in case it is a serious cause. We would especially suspect a heart attack in any chest pain that comes on suddenly and lasts for more than 20 minutes. Diabetic patients can have silent heart attacks as they may not experience any chest pain. So remember this if you have any diabetic patients who become unwell.